So my name's Sue Adams. I'm joint lead practitioner for specialist palliative and end-of-life care here at Royal Cornwall Hospital, and I've come to talk to you about the Cornwall and Isles of Scilly end-of-life learning path. I'm not from Cornwall, you can probably tell from my accent. So the nominations come from Royal Cornwall Hospital today, but this is a truly system-wide collaboration between all of the service providers across the county, those healthcare providers. It was developed by the Cornwall and Isles of Scilly End-of-Life Education Group, and that's got representation, small representation from all of the organisations that you can see detailed on the slide. It's a small group of professionals that set out with a vision to improve the experience of end-of-life care for patients and their families, undertaking a project that's outside of their usual work stream. We know that there's national documentation. The 6 Ambitions talks about people being prepared to care in all care settings, and we know that delivering equitable education is a challenge for people like domiciliary care agencies or care homes, where they're often Cinderella services. Next slide, please. There are geographic challenges for us here at Cornwall. We've got 100-mile-long county. When you enter the county of Cornwall, it's an hour and 20 minutes before you get to Royal Cornwall Hospital, another 45 minutes before you get to Land's End. And that means for our staff there are significant implications in terms of cost and time for accessing education outside of the county. So we really needed something that was far-reaching in terms of the organisations, but actually geographically could meet the demands of the area in which we live. So we had a low starting point. There was no county-wide programme of end-of-life education. So we set out to deliver something that was a mini and not a Rolls Royce. It's about making a lot of people a bit better at end-of-life care, not about making a small group of people very much better. We wanted something that can be completed at home, something that was supported by something tangible, by a handheld passport, and something that was also had a component of face-to-face education as well. So the learning path itself consists of 2 hours of formal face-to-face education. There's 11 core ELCA end-of-life care e-learning sessions and 1 session of choice, and there's an element of reflection as well, so reflection on practice and reflection on learning. People can do the learning path over their own pace over 6 to 12 months, and at the end of it they receive a badge. And the beauty of it, I think, for us is the fact that it's very flexible. We wanted something that's achievable and sustainable, and so people who are completing that face-to-face education, that might be a national study day, it might be stage and time communication skills training, or it might be local syringe driver training. It's very portable. They can fit whatever they want to inside that learning path. So we know that when we look at the learning path and we were deciding what was going to be, what should form the basis of what we selected to be part of our programme, we looked at the One Chance to Get It Right document and the higher level learning objectives that are contained within the One Chance to Get It Right, and that was what we based our learning path on, those higher level learning objectives. That's what informed the learning objectives and the learning outcomes for the passport itself. And we know the One Chance to Get It Right is what informs our end-of-life care in all the organisations, any setting that you're in, and also informs the CQC inspection framework. So we're trying to look at our education in terms of what's going to be most robust, but also what's going to support our organisational priorities as well. So we can see here that this learning objective that relates here to symptom management, the session that we chose there to reflect that was the symptom management of the dying adult. So we tried to pick our sessions to actually tie in with the learning objectives that we'd selected from the One Chance to Get It Right. But also we can see here by this slide that actually the learning, the sessions that we picked not only supported our learning objectives, but they also reflect our local strategic objectives. So this session was chosen with the goal of improving uptake of advanced care planning. And the learning path itself has that potential to address areas of concern. So here at Royal Cornwall Hospital, you can see on the screen there are results from the National Carer End of Life audit, and communication was something that was identified as a shortfall for us. So we have actually used our learning path as part of our National Carer End of Life action plan. It's one of the actions that we'll be supporting in response to that national audit, and also we can use the learning path to support those incidents and complaints that come in that highlight either the learning needs of individual members of staff or of whole wards or departments. For the reflective component, for that reflective learning objective from the One Chance to Get It Right document, we created downloadable PDFs so that people get the opportunity. We ask them to complete 2 reflections, and they have an opportunity to reflect on practice and also an opportunity to reflect on the experience of undertaking the learning path itself. And that final reflection is undertaken with a learning buddy, so somebody else who's previously completed the learning path. And that process of having that reflection and being able to document that, these PDFs, they can actually store those inside the handheld passport along with the certificates that they print off following completion of their e-learning sessions, and that is a helpful opportunity for you to be able to run through that with them as a learning buddy and actually really identify what learning they've taken from the path itself. Another downloadable PDF we have is the learning log. The learning log, it enables people to record the activity that they've undertaken, and what we're finding is that people are undertaking the learning path to support revalidation, so they can, it's a really nice and tidy way for people to evidence that learning that they've undertaken. The Cornwall Hospice Care website hosts our web page that supports the learning path, and we chose that site because we felt that most people who were looking to undertake learning related to end-of-life care would probably visit the hospice web page, or be most likely to visit the hospice web page. So that's our portal, if you like, for signing up for the learning path. There are links there to the end-of-life care for all section, the ELCA section, e-learning for health. Once people register on the web page, I'll get an email in my organisation, or whichever organisation is part of the learning path. You'll receive an email, and that will tell you that somebody's registered within your organisation. You'll be able to make sure that they get their learning passport, and there's a link there directly to the learning path itself. So we can see here the advantages of working with the national platform. So we work with eLearning for Health themselves, the programme team, to develop our programme, and that sits within the end-of-life care for all section, the ELCA section of eLearning for Health. And so our Cornwall and Isles of Scilly learning path is a visible entity within the ELCA eLearning for Health programme. It's a massive programme. There are 160 sessions on their own within the end-of-life care for all section of e-learning for health. So identifying sessions that we feel tie up with those learning objectives in the One Chance to Get It Right, that tie with our strategic priorities, means that people get just 11 or 12 sessions to choose from, and it rationalises that big choice that they have within the ELCA. Though obviously what we are finding is that people are doing more sessions. It's made them interested in doing these e-learning sessions, and so when I speak to people after completing the passport, they're telling me that they're doing sometimes as many as 10 additional sessions that they've seen that interest them. We launched our learning path in November. Here we are all cheerily at the Eden project. We were very lucky to get funding. One of our team identified funding via something called REACH, which is a local initiative here within Cornwall. We got European funding to actually launch. We had 140 people at the launch, and it was a great evening. We had 2 sessions run back to back. And we had over 100 people enrolled on the learning path on that evening itself. Yeah, so we were very lucky. That was a great send-off for us. It's not entirely current, this slide. Obviously, it's a little while since I submitted the presentation. Here at Royal Cornwall, we've got over 120 people currently undertaking the learning path. There are more people out there in social care, in nursing homes, in the community health services, in the hospice that are undertaking the learning path. You'll see here Alicia, who is an occupational therapy assistant at West Cornwall Hospital, who was the first person to complete the learning path. She's proudly wearing her badge there, and she's receiving her bouquet from our Deputy Director of Nursing here at Royal Cornwall. So it's a proud day for her. She's our first baby to be delivered. It was a proud day for us here at the hospital when Alicia completed her learning path. So far here at the hospital, I've had about 12 people completed the learning path, and I guess it's fair to say that the pandemic has had an impact on that. Some of it positive because people have been going on to do their COVID online learning, and some of it negative because people haven't necessarily been able to access the face-to-face learning in the same way. So I guess that's delayed some people completing their learning path. But hopefully we're seeing a slow and steady uptake of people registering to complete. So I suppose when we're thinking about what the next steps are for us, and we're horizon scanning for the future, there is opportunities for us to include the learning path within the electronic staff record to increase uptake. We've thought about adding the completion of the learning path to the desirable criteria in person specification when we're calling people for interview. Adding that into ward accreditation programs, and we hope to incentivise people by having things like a post-COVID champagne reception for the first 100 people that complete their learning path, which should give us a bit of time to save up, hopefully, to buy the champagne. But I think we're all quite proud of what we've achieved so far. It's a very small group of people, as you saw in the photograph on the end-of-life education group, and this was work that was undertaken outside of our usual work streams, and we hope that we've delivered something to the staff across Cornwall that will be democratic and accessible and sustainable going forward. Thank you.